Hi, good afternoon. My name is Anthony and I'm a respiratory care student in Southeast Community College. So, before I start, can I ask for your complete name, date of birth, please? Okay. So, would you mind if I'm going to do my hand hygiene first before I proceed my assessment? Okay. So, now that I'm done with my hand hygiene, I'm going to do my vital signs by checking the breath sounds and the heart rate, respiratory rate, blood pressure, and if possible, you can also check the O2 saturation if you have the portable pulse oximetry. So I'm going to listen first the breath sounds. Can you lean a little bit forward for me, please? Okay, very good. So, the reason why I am here because the doctor ordered a breathing treatment, which is a inhaler. So the specific inhaler that the doctor prescribed is the meter dose inhaler. Okay, so I'm going to demonstrate it to you of how to do the meter dose inhaler. So this is the meter dose inhaler. So assume this is a meter dose inhaler, by the way. So all you have to do is just put your index finger here in the top, in the canister, and then the thumb on the bottom. So this one on the top is where you're going to press. Later on, I'm going to teach you. And then first, you have to sit upright, and then try to lift a little bit your chin upward. And then when you're going to start, you have to exhale all your air out until you're able to feel that your lungs are empty. Then after that, you have to shake this canister few seconds, and then you can prime or try to actuate one dose. And then aside from that, when you exhale your air out, try to exhale away from the device. And then once you're done, you're going to put this one inside your mouth, and then it should be sealed by your lips, and don't bite the mouthpiece. And then when it's inside, you have to do a slow breathe for a few seconds, and then after that you actuate or press this one on the top, and then for around 3 to 5 seconds. And then after that, you have to hold your breath for at least 10 seconds or as long as you're comfortable or you're able to tolerate to. And then after you're going to do that one, you're going to exhale normally until you're done. Then after that, you're going to remove this one. Then after you remove this one, because this medication that I'm going to give is filled with corticosteroid, so I'm going to give you a cup or a glass of water, which you're going to rinse out your mouth and spit it out, so that it would prevent you from having thrush inside your mouth in mucous membranes. Okay, sounds good. So I already demonstrated before letting the patient do it, so that the patient would be able to understand well. So I'm going to let the patient do it right now. Let's assume this is a real patient. So patient is going to hold this, and then the patient will try to inhale slowly, and then once the patient inhales, he's going to actuate this one for about 3 to 5 seconds, and then after this, the patient would hold the breath for about 10 seconds or as long as they were able to tolerate to. And then after that, they just have to exhale normally, and then remove the mouthpiece from the mouth. Then now that I'm done, the patient also was able to perform well. So I'm going to reassess again the patient. by checking again the vital signs such as what I've said earlier, the breath sounds. I'm going to auscultate again, the heart rate, the respiratory rate, blood pressure, even peak flow measurement if possible, and also try to check the O2 saturation. So can you lean a little bit forward for me, please? And by the way, are you able to can you able to cough right now so that we can check if there's an amount of sputum from you, so that we can check that one. So if the patient can able to expectorate or cough, you can assist the patient, while especially if they're not able to mobilize their secretions, especially the elderly ones. Try to lean a little bit forward and try to tap at the back like this. Now that I'm done, by the way, if ever in case you need assistance, especially on how to perform the therapy again, or how to use the inhaler, you can just give a call in the hospital or in our department, or I can even give you a caller ID, or if ever, much best recommended if you can visit the hospital so that I can teach you firsthand. Thank you so much for your time and have a good day.